One of the commonest discomfort what patient feels after liposuction is because of the pressure garment. So I think here we have to discuss in a detailed way about the pressure garment. What is pressure garment? It's a tight fitting dress we give after liposuction over the liposuction area. It compresses the skin over the muscle because this is the skin, this is the muscle. We remove the fat in the in between area, so these areas are empty. What happens in the empty areas? Fluid tends to accumulate in the empty areas if you are not compressing. The fluid initially looks softer fluid. After that, sometimes what happens is it becomes harder and inflammation becomes more and it settles that way. And skin won't tighten much. So to avoid that issue, sometimes what we do is first 2-3 days we give a tight plasters because we leave the wound open in some cases. So because of that, what happens is a lot of fluid keep coming out. So the garment gets soaked. So we don't want it to happen. So first few days we give a tight plasters. After third day we remove the plasters. We give the tight fitting compression dressing. Basically the plaster also does the same. It compresses the skin over the muscle. But the garment also does the same. It compresses the skin over the muscle. So third day onwards when you are giving the garment, what happens is it constantly compresses the skin over the muscle. There is no dead space in that area. So fluid can't accumulate. And the nice shapes also form because of the compression garment. 70% of the complication happens because of the improper pressure garments also. You have to understand that point very clearly. Even when you are putting a plaster, see there is a lot of folds forms in this side of the tummy. Okay, the plasters when it folds and settles that way, what happens is the blood supply to the particular part of the skin will completely cut off. What happens? The skin will go for a death, complete death. So that area become raw wound, so it will become a scar. Same thing happens if you give a very tight pressure garment in the first few days. What happens? Over pressure lead on to a folding of the areas and abnormal compression lead on to a blood supply compromise. So the patient lose blood supply, they get a lot of superficial bruising. So wearing a proper sized pressure garment in without any folds is extremely important, avoiding the major complication like a skin death in the patients. Sometimes your zipper, where the zip comes, that itself makes sometimes the skin to burn or skin to become wounded. So make sure that any areas are not abnormally compressed, that zip materials not poking you somewhere. So monitoring the pressure garment is very important as a patient as well as a doctor. So understand this concept. And same way, how many days you need to wear the pressure garment? It depends on the volume of liposuction and area which we do liposuction, and all those things matters. Thighs and all we need to use it for minimum 1.5 to 2 months. Tummy 1.5 months, 1 to 1.5 months. And same way, how much volume we aspirate also matters. If you remove a lot of volume, obviously you need to wear it for a longer time. Pressure garment sometimes really irritates you, sometimes gives a lot of itchy feeling. When it becomes very itchy, that means you are not applying moisturizing cream adequately. You have to apply a lot of moisturizing cream, and maybe sometimes twice a day we ask the patients to apply the moisturizing cream. Sometimes the fabric might not be suitable for you, you develop a lot of allergic rashes, then you might need to change the garment, or sometimes we need to give some allergic medicines to counter that.